Thank you so much for your time today. My name is Janan, and today I will talk to you about whole body analytics and the use of artificial intelligence to personalize colorectal cancer treatments. The team consists of myself as the AI expert, Professor Justin Jung as our clinician, and Professor Paul Baird as our geneticist. While we are experts from different fields, we have come together for one purpose, and that's to automate current clinical processes in order to improve patient outcomes. Colorectal cancer is the second leading cause of cancer-related deaths in Australia. While there are treatments available, how patients respond to these treatments is highly variable, with some patients experiencing adverse reactions and poor outcomes. Clinicians typically rely on these images called CT scans, which are cross-sectional scans of the human body. They look at the distribution of tissues within the scans and identify how well or how poorly a patient is going to respond to their treatment. Along with CT scans, clinicians use this software to highlight those regions of interest and extract information accordingly. But the problem with the software is that it requires a lot of manual work. One image can take the clinician up to half an hour to finalize. So we have tried to completely automate the process using artificial intelligence. On the left-hand side, we have the 2D component of our software. So with the click of a button, all of those regions of interest are automatically extracted for the clinician, and this takes 5 seconds. So this shows that our software is 360 times faster than the current software being used. We also have the 3D component of our software. So the 2D component only looks at particular regions in the body, whereas the 3D component allows us to look at the whole body. So this allows us to look at distribution of tissues throughout the whole body, including fat, and also allows us to look at the BMI as well, which will help better predict how well or how poorly a patient is going to respond to their treatment. Before TRAM, we did make a lot of assumptions. We were mainly focused on patients and colorectal cancer clinicians. We thought our product was so easy to use that no training would be required. We weren't sure how people would respond to AI. And in addition, we came up with the solution, but we didn't know if anyone wanted the solution. Thanks to TRAM, we have gained many insight and conducted many interviews. We have identified new customer bases. We have confirmed with both clinicians and patients that they really do want the software to be used for diagnostic processes. Clinicians have confirmed that, yes, while the software is easy to use, some training is still essential for them to feel more comfortable with using the software and for them to also better explain the software to their patients as well. We have identified that with a good product, we also need good customer service and good tech support, and we have also developed a 3-year plan. So the customers we have identified include hospital administrators who will help us integrate the software into clinical settings and into hospitals as well. And we have also identified clinicians who use CT scans for other purposes or other areas of medicine. So our next steps include internal validation, just to keep perfecting the software. Then after that, we have our first stage prospective study in which we run the AI diagnostic along with the clinician's diagnostic in parallel and then compare the two. And then we have our second stage prospective study in which the clinician will start using the AI for their diagnostic processes. And then finally, using all of this information, we will register the software with the Therapeutics Goods Australia. So that is it from us. If you are a clinician who uses CT scans for your analysis, including other cancers, veterinary, trauma, injury, or any other area of medicine, we'd love to hear from you. Please either email us on any one of these email addresses or reach out to us in the breakout rooms. Thank you so much for your time today, and thank you very much to TRAM.